Hello, everybody. Today is Friday, December 11th, and I am elated for our very special guests and biological dentistry experts, Mónica, Calderón, and Paul McLinn. Mónica and Paul, how are you both doing? And thank you for being with us today.
Very good. Thank you.
So we have your beginning presentation here, so let's just dive right on in.
My name is Paul McLinn. I have my wife, Dr. Mónica Calderón. We're biological dental office here in Vancouver, Washington. So I'll spend a little bit of time explaining what biological dentistry is. So Dr. Calderón, she's accredited with the International Academy of Oral Medicine and Toxicology. She's SMART certified. That stands for Safe Mercury Amalgam Removal Technique. She's currently one of two accredited members who are also SMART certified here in the Portland metropolitan area. There are over 2,600 dentists here. Nationally, there's approximately 154,000 dentists throughout the country. Combining with her being a board certified doctor of naturopath, she's one of fewer than about 100 dentists in the country doing the level of work we're doing. So she did complete her Doctor of Naturopathy through the American College of Integrative Medicine and Dentistry out in New Jersey. So let me go back to that screen again. The important thing about this is the state of Washington, they do recognize us as dentists. We do not provide any naturopathic services in our office in order to respect our referral source and avoid any conflicting appearance that the services offered in our office. Otherwise, we compete with the services offered by our valued source. Most of the integrated medical doctors and naturopaths here in Portland refer their patients to our office because Dr. Calderón is one of the only ones that understands what they're trying to accomplish from a systemic standpoint. And so a few issues. I'm just going to point out this x-ray here. There's two common dental materials, mercury amalgam and gold. I can go into my garage, grab a simple multimeter, and measure the electric charge across those two dissimilar materials. And the problem with that is you put an electric charge here in your mouth, close proximity to here, which is your brain, with all electrical, you've just introduced a systemic effect from the materials. And the systemic effect caused by the materials of dentistry is outside of the scope of dentistry, which is why I had my wife get her doctor in naturopathy so she could talk about it. So in this x-ray, I'll let her explain a little bit about what you're looking at here.
So this is the upper left side of a patient's mouth, and it has all the three molars, including the wisdom teeth, and up to the second premolar. Everything that you see on those teeth is mercury amalgam fillings. That's why they look so shiny and reflective. But the other thing that's very visible on this x-ray is there's something going on with the roots of this other tooth, number 14. Now, that is a pretty large infection and is easily captured by this type of x-rays. But in biological dentistry, you want to be using the cone bead cut tomography to be able to see the teeth and the mouth in 3 dimensions, where you can see better the lesions, even smaller lesions, or smaller infections, or smaller things that can show up in the sinus that will not show up on a 1-dimension x-ray like this one.
See, the one thing is x-rays like this, they're a 2-dimensional representation of a 3-dimensional object. And so when a regular allopathic dentist looks at this, they may say, that looks perfectly normal, because you're taking that 3-dimensional data, squishing it down into 2-dimension, and this isn't particularly apparent. When you put that on a cone beam cat tomography, which is a 3-dimensional representation, you're able to slice that axially, coronal, and sagittally to be able to show the full width and breadth of the issue that's going on there. And I may have gotten sidetracked on this. This is another example. This is a panoramic x-ray. And so looking at this.
This is again a 1-dimension x-ray of a mouth that is obviously 3 dimensions. If you're only looking at these panoramic x-rays, you may miss the infection that's going on the tooth on number 3 up here on the upper right quadrant. And the other infection that's going on the other root canal treated tooth on the lower left quadrant.
And one of the other things, so I mentioned mercury amalgam and gold. There's an equation. I'm an engineer, not a dentist. Within engineering, there's an equation: V equals IR, voltage equals current times resistance. So when I talk about electric charge, I'm looking at V. When an integrated medical doctor or naturopath does resistance testing, they're looking at R. We're looking at the same thing, just different sides of the equation. And so it's interesting to note that crowns that are done in excess of 10 years ago, the primary material used for core buildup, which provides sufficient strength for support of crown coverage, it's like a stud in the wall, out of sight, out of mind. What you see in a wall is you see the paint or the veneer of the wall. You don't see the studs behind it. And I use that as an example because here in the Pacific Northwest, they love to build out in the rain. And what happens? They finish the house off, put the sheetrock up, and paint it. Everyone's happy about the color of the paint, but they disregard the mold that's now growing in the walls. So what I'm referring to here, let's just look at this tooth right here. You see the crown. It's so an X-ray is a function of density, something that's very dense, such as mercury amalgam, or gold will show up as white. Something that is less dense, such as, well, up here you've got the eyeball. Normally these sinuses here would be black. They're actually clouded up, so that's a flag saying why would they be clouded. There could be a host of reasons for that, including seasonal allergies. But excuse me.
I go to the next one.
But what you're looking at is that's mercury amalgam underneath it. In my world, when you take mercury amalgam, stack a gold crown on top of it, that's called a battery. Now you're dealing with galvanic currents and electrolysis. In another example of a battery, if you have mercury amalgam fillings, take a piece of aluminum foil, put it in your mouth, and what happens? You get shocked. The reason is you've completed the circuit. So that's the same thing that's happening here. You're generating galvanic currents and electrolysis as a function of the material. And there are patients looking at this X-ray. There are a bunch of dissimilar materials that are going on. There's this thing called tinnitus. Tinnitus, there's true tinnitus. If you've worked in demolition or maybe a shipyard and you've destroyed the tympanic membrane in your ear as a function of the frequencies that you're exposed to, there's also material-induced tinnitus, which likely this particular patient here would be suffering from because of the materials. So you'll get the ringing of the ears. Also, we're constantly bombarded with radio frequencies. This is a perfect receiver. So a person like this, if they have symptoms where they hear voices or radio, it's because they are picking it up with their mouth as a receiver.
They become an antenna.
They become an antenna.
Especially if they have implants in the mouth and they happen to be titanium implants. Actually, they don't even have to have them in the mouth. I myself had a piece of titanium. It's called a marker after you get a biopsy in the breast, and they put a titanium marker in 2009, and by 2010, I not only had a rash all over my body as a result of the allergy to titanium, but I was picking up radio waves in the middle of the night that kept me awake for many years until I figured out that it was that. It was the titanium reacting with the mercury that was accumulated in my brain from my own profession and my own metal mercury amalgam fillings in my mouth.
And so one of the things is when you say we're working with a patient and we effectively hit a wall where you're not proceeding forward, you have to peel back those layers and find out what else is happening. Does a person have a titanium implant in their foot, ankle, and knee? And what does the foot, ankle, and knee have to do with the mouth? Guess what? You can measure the electric charge being generated between the dissimilar materials in your mouth and the rest of your body, which is really important because now it creates systemic effects. And unfortunately, aside from the International Academy of Oral Medicine and Toxicology and a couple other of the holistic dental organizations, you don't have dentists dentistry is right here, neck and mouth. and everything is compartmentalized. So you have a podiatrist who's compartmentalized, looking at the foot, ankle, and knee, cardiologist looking at the the heart. You have all of these specialists that everything's compartmentalized, but being able to share that information to understand the systemic effect. And it's interesting because Eastern medicine is known for 5,000 years. Your health starts in your mouth. So when you have a complex case in Eastern medicine, you get all the doctors together, and the head of the table is the dentist. And here we have it completely backwards. They joke that if you fail out of medical school, you could always become a dentist. So I apologize for getting sidetracked on that one. Moving on, we do follow the safe mercury amalgam removal protocol of the International Academy of Oral Medicine and Toxicology. And briefly, I'll let Doctor explain what all that is about.
It's also part of the SMART certified technique, and it's a matter of keeping the patient as clean as possible from getting any exposure to mercury by particles. The mercury vapor that's generated, the most when you're drilling the mercury fillings out, it gets cut up into bigger pieces, so you can chunk it out, meaning sectioning in bigger pieces, so you don't have to drill and drill and drill. And the patient has an oxygen mask. We also have something called an elephant trunk, which is a special high vacuum suction. Patient has to have a rubber dam in place, and they can have the option of having nitrous if they have anxiety, but usually is the oxygen flowing through to the nasal cannula, with them having the rubber dam and the proper protection for their clothes and hair cover.
And I want to comment about mercury just from the standpoint of materials. We're calling it mercury amalgam, and one of the questions is, why do we call it mercury amalgam when all the other dentists, most other dentists, call it silver fillings? Mm-hmm. So chemistry 101, when you name a substance, you name it with the greatest concentration of the material within that substance. So to call it silver fillings is a misnomer, because mercury amalgam consists of approximately 16% silver. It's over 54% mercury. So by chemistry 101, you call it mercury amalgam. Now, what's wrong with mercury? As far as it, again, it's a standard of care. The Dental Association says there's absolutely nothing wrong with it. So this becomes really important with patients dealing with issues like Hashimoto's or Graves' disease, both of which are exacerbated by mercury. And if you have mercury amalgam filling, you can open your mouth, look in it, and you have a black filling. It's called mercury oxide. It oxidizes. A hygienist, so you can be exposed to the greatest amount of mercury when you have it worked on, and something as innocuous as a dental cleaning will expose you to mercury vapor. So when that hygienist, I'm just stick with that as an example, when the hygienist comes along, they've been taught shiny equals cleans. They come across these black oxidized mercury amalgam fillings, and they want to polish them up to make them look nice and shiny. The problem with doing that is the mercury releases off of that. Your nose is right next to your mouth, so you get to enjoy that toxic exposure. What doesn't get inhaled goes up into the room, sucked up into the heating and ventilation, and pumped out wherever that goes. So if you were to have a blood test done within 3 hours of having a dental cleaning, it would show your toxic burden from that dental cleaning. If you have the very same test done in excess of 3 hours, it shows nothing. Not because you weren't exposed, it's because it's already bound up. It binds up to the fatty tissues of your brain and your liver, and nobody's going to take a core sample of your brain and liver to show your toxic burden from a dental cleaning. Now, in our office, I sourced out a mercury instrumentation constant mercury vapor analyzer. I'm able to measure down to 0.1 micrograms per meter cubed. And why do I do this? To be able to protect my wife and her staff. And by doing that, I'm able to then effectively protect our patients. But in the dental office, it's about accumulation. So even following the safe mercury amalgam removal technique, you want to be able to keep that exposure as minimum as possible. And we're actually able to then measure, okay, is my hygienist getting a little aggressive as we don't let her polish any of the amalgams, but if she's in there picking away at the plaque and calculus and gets a little aggressive on those mercury amalgam fillings, you'll have a release of vapor. Same thing with a person that has, like in that previous x-ray, a person has a lot of amalgam in there. If they're chewing gum, or they've just had some nice hot cup of coffee or eaten, they will emit mercury vapors, and you can measure that. So it's really quite fascinating.
The IOMT has a great video in their website called the Smoking Tooth. Actually, we have it on our office website as well, but it's called the Smoking Tooth, and it shows exactly how anytime you make any surface connection with the mercury amalgam fillings in your teeth, whether you're drinking coffee or anything hot, cold, or chewing, you will be emitting the mercury vapors. And so when you get the mercury vapors, you inhale them through your nose and mouth and down into your lungs through the bloodstream. All of that mercury vapor gets passed through the bloodstream. And as it goes in the bloodstream, then it accumulates in different parts of your body, like Paul mentioned earlier. That's why a blood test is not the right test to check and see what your exposure has been, for several years. There are many different tests that can be done. Some of them are hair analysis tests and urine tests. And those you can definitely talk to your naturopathic doctor, and he or she can walk you through it to see which one will be the best for you. And that's how you can get a proper analysis of what is your not only mercury content, but also heavy metals in general, because most of those tests test for many things like lead and arsenic and antimony and mercury, of course.
So I want to qualify the statement that I had made about the mercury exposure. So what does that make a difference between a biological dental office and a regular allopathic dental office? 58% of the dentists in the country call themselves mercury free. That's fantastic. It says they're not going to put mercury amalgam in a person's mouth. Again, most don't understand the sentence that I just said, because you're exposed to the greatest amount of mercury when you have it worked on, and something as innocuous as the dental cleaning exposes them to mercury vapors. So now looking at real numbers, the highest rate of suicide of any profession is dentistry. It's a well-known fact in the dental industry. They like to attribute it to type A personality, and it's not type A personality. In fact, in Washington, was about a year and a half ago, they, in all their wisdom, decided to create a rulemaking that mandates all dentists take mandatory suicide prevention continuing education that has to be updated once every 5 years. And that's like putting a big Band-Aid on an issue that is not addressing the issue. Also, dentists tend to retire early, not because they're financially set. They can't hold the handpiece anymore because of the trimmers. They can't. They diagnose that as Parkinson's and ALS, and it's neither. It's mercury toxicity. So that's a little bit of understanding on mercury amalgam. This image right here, we're getting into now root canals, and you can explain a little bit about this.
Yeah, we placed this image in here just to show you on this x-ray, the lady she came to us with the 2 root canals. She has had them for many years. She had them treated, and one day both of them got infected. Well, before she came to see us, she went and had it removed at a regular dental office, and not only did they remove the 2 teeth, but they also place allographic bone graft. That means that it's a type of bone that is not her own. And when she came to me, she had so much pain, and all these tiny little particles that kept coming out of the gum tissue was her chief complaint. So I asked her, what was the treatment that she received, and did they put a bone graft? And once she confirmed all of that, I told her, I said, all those little grainy particles that you're feeling in your mouth are the bone graft material. Your body is rejecting them, which in a way is good, because you don't want to force your body to have something that doesn't belong there. For example, you will not go get a kidney transplant without being tested for the donor. Unfortunately, bone grafts in the mouth are being placed without testing the patient, whether they are going to be susceptible for it or not. And the reality of it is that the only bone that is the best one for the patient is their own bone. The surgeon can grab the patient's bone graft from another side of the mouth and know that it's the patient's own bone that is going to be used. This will allow them a much better time healing and a much better chance of the bone actually healing. So with her, what we did is we ended up cleaning up all the particles that kept on coming, and we injected ozone. And we did that for several weeks on end until the bone, can show radiographic changes that it was healing. And it took a few weeks that turned into months, but eventually she did. She completely healed the two pieces, and no more pieces of bone graft were coming out anymore.
Wow.
But to me, that's why I always tell the patient, if you had to see an oral surgeon, because I can't do an extraction for you because the root is too long, the sinuses are too close, or the root is twisted, and it can be more complicated than I like to do, I always tell the patient, please ask the oral surgeon to make sure that they use your own bone if any bone graft is needed for the socket where the tooth is going to come out, and if you're planning in having an implant, especially if you're going to have implants, let's have a full conversation about what type of implants do you really want to have. The zirconia ceramic is the most biocompatible. The titanium one is not as compatible at all with the human body, even though it has been used for many, many years. And in our profession, we have been told that just because we've been told the same thing for decades, it's got to be it. Well, that's not the case. And it's not just in our profession, but in many things. Just because they have been saying it for many decades doesn't mean it's correct.
Mm-hmm. So a couple of things about that the doctor mentioned there. Ozone. What is ozone? Ozone is a negatively charged triatomic oxygen. Oxygen's O2, ozone is O3. So having that additional electron, actually not really the electrons, the
charge,
being the negatively charged, it wants to seek out areas of inflammation and infection, take that out of the picture to then allow your body to do what God intended to do and begin healing. So we use ozone in all facets of dentistry, delivering via nasal encephalization, injecting directly into the bone like she did here. And you can compare the original bone right there with a couple weeks later, and then as it's the bone is really healing right there. You also can go across the tympanic membrane. You can explain a little bit about that.
It's excellent for people with allergies, seasonal allergies. When you have seasonal allergies, not only is your nose and sinuses all inflamed, but your entire inner ear is inflamed. Ozone is a great anti-inflammatory. It also promotes your immune system to do what it's supposed to do, what it was intended to do. Instead of, if you only take antihistamine medication, then all you're doing is trying to quiet down a reaction that is only going to get stronger. And that's why people are always in antihistamine allergy medications. But the ozone will work by enabling the immune system to do what it's supposed to do.
And also when you're injecting ozone directly into the bone, particularly in way of an area of ischemic bone is dead necrotic bone, you can radiographically see that area of ischemic bone shrink up. So when you then get in there to surgically remove that, you don't have to remove as much of the area because ischemic bone, regular bone, nice and solid, just like pounding on the top of your desk. When you drop into ischemic bone, it's like pudding. You scoop it out. It's just nasty, necrotic, dead bone. And a lot of the bacteria, it loves to hang out there. Particularly when you get into Lyme disease, the bacteria associated with Lyme loves to hang out in the ischemic bone, necrotic bone in way of failed root canal treated teeth. One of the other things that she mentioned was platelet-rich fibrin, PRF. Fibrin is the building block for bone. Without fibrin, you don't have bone. And so that really, you're able to then draw out your blood, spin it up in a centrifuge, and then place it as a plug of platelet-rich fibrin to be able to aid in the bone regrowth like you see in this patient right here. The last thing that she mentioned is titanium implants. No one is putting pure titanium. It is again, the standard of care here in the United States. Most other countries around the world and Europe, they don't use titanium anymore. They'll go primarily to the zirconia. But nobody's putting pure titanium. It's an alloy, a mixture of various materials, and it's the other materials that get you. The concentration of the palladium, the nickel, the aluminum, the tin, and the manufacturers put that in for the strength characteristics. And again, that you're setting up that circuit again for the galvanic currents and electrolysis. And later on in this presentation, we'll get into where you'll see what's called well, it's diagnosed as perioimplantitis, which is again not correct. It's degradation of the bone in way of the implant that's failed as a function of the material interaction going all the way back to, say, antipsychosis medication, which is triple fluorine. So, but I'll touch on that here when we get to it. So, well, fluoride. We do not advocate the use of fluoride. Fluoride destroys a person's thyroid and pineal gland. We live in a country that's documented as obese. How do people have a chance to address the issue of obesity when the main regulator controlling weight, your thyroid, is being destroyed? So from a toxicity standpoint, fluoride sits comfortably nestled between lead, which is slightly less toxic, and arsenic, which is slightly more toxic. They're all three in a row. 1, 2, 3. And I don't know the last time you were in the dental office and they said, today we're going to do a lead application, and that's less toxic. Anything more to add on fluoride?
Yeah, all the medications out there, prescription medications are out there for treating anxiety, for treating depression, and anything with the psychological, psychiatric form of any condition. All of those medications have fluoride, and they're usually triple fluoride. Now, the biggest thing with that is that they have done experiments or studies showing that they know the medication has the amount of fluoride in it. And when they try to measure the outcome of that fluoride in the patient's urine, the numbers don't add up. So where is all that fluorine going? And is it going, most of it, a lot of it gets stuck in the bones. Other ones, some of it gets stuck in the pineal gland and the thyroid gland. It calcifies these glands. But the biggest thing is bone can get the fluoride stuck in there. And as people age, primarily women who then end up with osteoporosis, their bones start to change and remodel. And the same way that lead gets stuck in bones, so does fluoride. And then the fluoride doesn't come out of the bones. It gets stuck there for good. But now you have an older person who's aging, primarily women, who then can be tested for heavy metals. And one of the biggest ones that may show up is lead, because lead is now being released out of their bones, and fluoride is staying in the bones, making their bones weak. So there is a lot of studies that have been done, and they're showing that, and you don't see the pharmaceuticals changing their biochemistry for the drugs that they're putting out there. They're the same thing. So, and if you see problems in the skeleton bones, you're also going to see problems in the mouth, because we have a maxilla and a mandible, and that's bone.
And it's interesting to note a person dealing with Hashimoto's. Hashimoto's is a function of decreased thyroid, exacerbated again by mercury, but there's an emotional component to Hashimoto's. And so doctors to address that emotional component will often prescribe antipsychosis medication, which is triple fluorine. So now you just heard what we talked about with fluoride, and the medication that's being prescribed to address the emotional component is further destroying the thyroid, which is the main issue that they're dealing with, which is mind-boggling that happens. There are people that they have to have that antipsychosis medication to help from preventing suicide, but again, that's an example of a disease that the medication is prescribed that further exacerbates what they're trying to treat. So, biological dentistry, what does that really mean? When from biological dentistry, is we evaluate every single material from a standpoint of biological compatibility as well as toxicity. And there are tens of thousands of materials within the dental world. When a person has a filling done, say when you have Mercury Amalgam, you have to restore it. So often you restore it with a composite filling. Not all composites are equal. What we found is manufacturers are slipping in ingredients that we simply don't agree with. Cadmium is one of them. Cadmium is wonderful for coloration. So you look in the mirror, smile, your teeth look nice, white and pretty. But down the road, your integrated medical doctor or naturopath is diagnosing you for cadmium, and you wondered, how in the world did I get cadmium? From a dental filling. Now, the one downside with cadmium is you can't look at a radiograph and ascertain, is there cadmium in there? Like you can with mercury amalgam or gold or nickel. I mean, nickel shows up as a radio opacity where you can almost peer through it. So I'm going to go with that one. So the other thing is food. Hippocrates said, let food be your medicine and medicine be your food, and how far we've gotten away from that. She is also a member of the Weston A. Price Foundation. We are also a member of the National Health Federation. We're so excited about being able to meet Scott Tips at a couple of our conferences now. And as you know, the World Health Federation is the world's first health freedom organization. It's the only one that's able to speak on our behalf and submit scientific research. They speak at the international meetings of the Codex Alimentarius. So we're very proud members of that. I'll let you explain this is a cone beam cat tomography looking at an axial, sagittal, as well as a coronal view of a tooth.
So this is the difference between a regular X-ray and a cone beam cat tomography, because you can see the tooth in 3 dimensions. You can section it sagittally or occlusally, and you can go down every single side of the tooth that has either any potential for pathology. You can also view the sinuses well and review them for any mass or mucus that should not be there. In these X-rays, you see the root canal treated tooth on the lower left side, and you can see the amount of space in between the root tip and the bone that shows as a dark area. That's an infection on that tooth. And then go to the next one. This one is a regular X-ray taken from a patient who had braces, and she had her teeth moved several times from having braces. She was in braces for about 5 years. But sometimes when tooth gets too much trauma from having forces put upon it, the nerve on the tooth dies. And although she didn't have a cavity on the tooth, she had a very small filling on the tooth, but all the trauma that the tooth went through, it caused the tooth to, the nerve on the tooth to die, and she ended up with a pathology at the end of the root. The tooth eventually had to be removed.
So one of the things I'm going to mention, and I don't know if we have a section in our slides on this, root canals. Why do we not advocate root canals? There's 2 reasons we don't advocate root canals. One is from a material standpoint. The other is from a Meridian standpoint. So from a material standpoint, when a person has an infection, they're typically prescribed antibiotics. We prefer a naturopathic approach, but again, anytime you're dealing with an infection in the head, close proximity to the brain, you have to take it seriously. Most people, unfortunately, don't take those antibiotics until they're finished. They take them until they feel better. So now you're still dealing with infection in the bone. And when I say infection in the bone, this image right here shows what I'm referring to. Then a doctor comes along and does a procedure called the root canal. And this right here is a root canal. It's where they remove the pulp or the nerve of the tooth. And again, on this tooth, that's the nerve, the pulp of the tooth. So they remove that and replace it with a material called gutta percha. Gutta percha is natural. It comes from a tree that's grown in Brazil. It's also grown in Malaysia, but the manufacturers need to be able to preserve that natural product. So they dip it in a preservant. Also, they dip it in the preservant so you can see radiographically, it reflects back with this more dense material, but they dip it in one of three materials. The most common is they dip it in mercury. If they don't dip it in mercury, they dip it in barium. If they don't dip it in barium, they dip it in formaldehyde. So you effectively have mercury dipped gutta percha sealed off into a tooth that still has bacteria in the bone, and dentists are always scratching their head wondering why root canal treated teeth have an extremely high rate of failure. And then again, you come along, you do the core buildup. This one doesn't have the mercury amalgam, but you do that core buildup, then put a crown on top of it. That often is that porcelain fused to metal. That metal is a very combination of various materials. One of the components being gold. Gold on top of mercury amalgam is a battery. And in this image here, you can see a host of other materials. You see brackets. Some of these brackets have concentration in nickel because you can see that radio opacity to it. And I'm not sure what this is. Probably some stainless steel wire.
Most of them has that.
Again, an alloy. So you have a host of various materials that are happening here. Going on to this X-ray here. This again back to your panoramic, and what she's looking at is that tooth that's now been extracted.
Yeah, but the area of the bone had to be treated with ozone because there was so much destruction from the infection that you then want to make sure that the bone has the cells and the energy that it needs to properly heal. Ozone provides some of that by keeping the bacteria count down, by keeping it and giving your immune system the boost to heal things.
And so often a person will have maybe metallic flavors in their mouth, and it's from that galvanic currents and electrolysis, and it gives them that sensation. Mercury.
You already said that.
Okay, I covered most of this. What is mercury free versus mercury safe? So I've covered a bit of this already. Is there anything that I hadn't covered, Alex, that you would like me to communicate?
I mean, for now, I'd like to possibly expand on the battery. Like, what does that mean, a battery in our mouth? And then also maybe some of the specifics around the vapor of a cleaning, you know, that might happen, like a common scenario of someone's chances of getting mercury poison from the vapor. And then eventually I'd love to look into case studies. Like, I know this is something I can Google about, like different case studies of how quickly one could detox from not just, you know, mercury, but also other heavy metals. So
each of those questions have gigantic responses. So we may actually have an entire, another segment on this. But in short, when so let's go back to that person who's sitting in the chair having a cleaning done. Now, this is important also to someone waiting in the waiting room, because if a person who comes into our office and is maybe they've been dealing with Hashimoto's or Graves' disease, both of which are exacerbated by mercury vapor, they have to absolutely know their exposure point. So if they go into an office that doesn't understand what you and I are talking about, they get to enjoy everybody else's mercury, even if they don't have mercury in their mouth, because as that example of the cleaning, as that mercury oxide is being polished off of the black oxidized mercury amalgam filling, the vapors then release. What doesn't get inhaled goes up into the room, sucked up into the heating and ventilation, and pumped out wherever that goes. So even if someone's just sitting up in the front office reading a magazine, they don't realize they're being exposed to the vapors from what's happening in the back office. If you walk in to a building, and near us, there's a dentist on the third floor, and they have a building-wide heating and ventilation. So what's the significance of that? It was a nice cost savings to be able to have that incorporated in your leasehold. However, if that patient with Hashimoto's or Graves' disease walks into the first floor to a completely separate business, they get exposed to what's happening from the third floor, because that mercury vapor, again, polished off of the mercury amalgam filling, sucked up to the heating and ventilation, pumped out to the rest of the building. And again, you can take the mercury instrumentation constant mercury vapor analyzer and qualify that statement to be able to show the mercury exposure in that other location. Does that answer the question as far as the mercury vapor?
It does. I mean, kind of like you with the engineering perspective, I sometimes like to think in terms of parameters, like kind of what's the limit of, the mercury vapor, like, where it's like a minuscule amount that doesn't really affect us, compared
That's
to
a great question.
stuff like that.
And Chemistry 101, how much mercury is good for you?
Mm-hmm.
That's the answer.
But on the other hand, there are people, so that your question is the same statement that the ADA has used for decades to say, if mercury is so bad, how come everybody's not dead? Everybody that has ever gotten a mercury silver filling, mercury amalgam filling, whichever way they want to call it, how come every single one of those people are not dead? And the reason why that happens is because every single one of us has a different immune system. Every single one of us has a genetic code to be able to identify the toxin and be able to decide what to do with the toxin. So when you get exposed to a toxin, say the mercury, you breathe all the fumes of the mercury fillings that are being drilled out by your dentist, by your regular allopathic dentist, and they go straight into your bloodstream, and then you from the blood, within 3 minutes, it gets absorbed into your brain, into your kidneys, and your liver. So you might not feel anything right away. Your body, if you're a young person with nice, healthy immune system, perhaps you grew up in a farm and you ate good food and you had, good genes, you may never have a problem. You may also continue to go to the dentist and have more fillings put in, and you may never have a problem. You may also have the same response with root canals. You may never have a physical problem that you can say directly, this is what's happening because of this. However, there is a great number of people that that's no longer the case. And the reason for that is because the amount of toxins that we have been exposed to environmentally and through food and through dentistry is enormous. It has changed like it wasn't ever before, even 50 years ago. So now our bodies and the new population, the new generations, they don't have the same strong, robust immune system that other people grew up with. They just don't. Our own two daughters, they don't have the immune system that his family or my family had long time ago. And primarily is because I was exposed to mercury, not only through dental school, but through several years of practicing like an allopathic dentist. And even though neither one of our childs has a single mercury filling in their mouth, they have mercury toxicity because they were in my wound when I was practicing without any caution.
Wow.
So that's the biggest thing.
You would think eventually there could be a class action lawsuit or something against.
Well, this is, now you're getting into why the circling the wagon. Mm-hmm. But the one thing with my wife, because she's been practicing dentistry for 23 years, how do we get into doing the type of dentistry we're doing? Her profession almost killed her. Now that's finite. And imagine the epiphany when you realize not only did your profession almost kill you, you've been doing harm. So you're absolutely right. There's a huge litigious aspect of what's going on, and there's a huge reason to be able to not expose that. And if you go back to peeling back the layers on how we began using mercury amalgam, you go about 150 years ago, where there were two dentists in New York that had this inexpensive material that all the dentists at the time said, that's mercury, that's a poison, you don't want to put that in a person's mouth.
Yeah. Like
you had enough of the dentists that finally got together and said, we'll use this inexpensive material, and they created a group, and that group is the seed, which is now the American Dental Association, who holds the patent on amalgam. So there's a massive conflict of interest on an organization that's suggesting and maintaining that there's nothing wrong with Mercury Amalgam, and teaching every single dental student coming through school, there's nothing wrong with it. So my wife had to actually take all that she'd been taught, throw it out the window, and start learning. And I highly respect that. And many of the other professionals at the International Academy of Oral Medicine and Toxicology have done the same thing. They've gotten into this because of their own health and recognizing they can no longer continue going down this path knowing they're doing harm. So,
well, that's very touching, and I can't even imagine going through that, almost having your own profession, kill you. I mean, it's really something else. So thank you for being a trailblazer with all of this, with the biological dentistry. I mean, because of you two is the first time I heard about it, and now we're doing this video, but I'm feeling pretty inspired that once we upload this, we should actually go live at some point, possibly to actually try to reach, more people. So after some people watch this, if they're looking for, something else, we could easily, with the software, we can have it go through our Facebook channel or the YouTube channel for the National Health Federation.
Yeah, well, there's some great references out there. And just like when new patients call our office, I recommend they read the book, The Toxic Tooth. It's written by Dr. Thomas Levy. Dr. Levy's a board-certified cardiologist. And what's a cardiologist talking about dentistry? Guess what? And I didn't actually talk about the Meridian aspect of that root canal. The Meridian aspect is actually the most concerning. What is a Meridian? A Meridian is like a circuit. A circuit is like a light switch. You flip on that light switch, you expect your light to come on. If you have a short circuit, you flip on that light switch, your light doesn't come on. If that short circuit's bad enough, you flip on that light switch and you have a fire in the wall. That's like a meridian. A meridian, each tooth associated with specific meridians, each meridian associated with specific organs. If you have a short circuit in that meridian, and how do you short circuit a meridian? You put a root canal there, and you will find problems along that meridian. Somebody who's healthy, their health will mask those issues, but they always show up. Someone who's more immunocompromised, those issues are already showing up. Did I miss something on that?
Well, could you add with how it can short circuit, but then also be a battery? Because when I think of a battery, it's like something that's powering something that eventually needs to be recharged or replaced.
So two different things here. The meridian, again,
is the energy flow through your body, through the organs, and part of that is like a highway, and every one of those roads is also connected to one of the 32 teeth that we're supposed to have in our mouths. So if you have a root canal in one of those meridian highways, that energy doesn't flow through that tooth. So there's a shortcut, there's a short circuit between the energy flowing and what is supposed to come out once the energy is supposed to go through the tooth. Because now you have a tooth that's dead. With a root canal, a tooth is no longer alive.
Wow. And it shows the health starting in the mouth from that energy perspective, too.
Right, because that's one of the easiest places that people can cause circuits to be stopped. Because, for example, if you have a cut that gives you gangrene, you're not going to keep patting it until somehow it magically going to disappear. If you have gangrene in your arm or your leg, they're going to cut it off and remove it, correct? But you can have a tooth that is dead. And by definition, that tooth is the same equivalent of gangrene because it's dead, but you keep it there. So the tooth stays there, but it's giving your body all these other potentials to get the toxins that come out of it to be spread out all to your bloodstream and to give you health issues. And it's really well explained in the book Toxic Tooth.
And then same with root cause.
By Dr. Thomas Levy. And the documentary by Oh, Dr. Levy's in there, and the IABDM.
So it's a documentary called Root Cause, which is currently available for free streaming on Tubi.
Okay.
And all that we talked about, it does a great job of laying it out visually. And so that's really good. I have a couple other slides here that shows some of the ischemic bone and failed root canal treated teeth as well.
It was like 50 slides. Did you go through them all? Or most?
No, not yet. Not yet. I had a few more. So this right here is again what she was talking about. When you have a cut on your arm, you can see that. Well, often people disregard what's in their mouth. This is nasty. This is pus that's exuding into the mouth from an infection. And so the one thing about this is that relieving of that abscess actually helps from the pain standpoint. But so that's what you physically see when you open up the mouth. And you want to have you comment on this, and I'll
so we have, this is the palate side of the mouth. You know, this is an upper tooth, and you can see where it's all swollen and where the pus is coming from. Then when we go to the x-ray, we have two different type of x-rays. This is a regular x-ray, and the roots on this tooth, they're very much close to the sinus, maybe even very, very close, if not inside of the sinus. Then the white area surrounding the sinus is a bone, is the cheekbone. So in this regular x-ray, you see that there might be something going on. But if you didn't see the pus coming out of the palate, you can look at the x-ray and say, well, it's not 100% clear. And then the comparison with this x-ray and a three-dimensional x-ray is that now you can see how big the infection is. Because all of that black area surrounding that root back there, all of that is the infection. And it is in the palatal root, which is the root on the side of the palate where you can see all the pus coming out in the patient's mouth.
And this is another view, different date of a panoramic that was actually transferred by another office. And you can see.
Even on that one, you don't see it clearly, the massive infection that's in that tooth, until you take a CBCT cone beam tomography, and then you can see how bad it really is.
The bottom right, it's a lot of dark. So the dark is more dense, the bottom right, or right from, like, if I think it's the right if you were the person.
Yes, the dark would be less dense. And this is actually normal bone.
Yeah, the other side on the bottom is what I'm talking about.
Okay, over here.
Yeah, right there. See that? I was wondering about that.
Oh, that can be a shadow from the same space. See if you could.
Well, because of these right here, you see all of this metal, it's casting a shadow down there.
Oh, okay. That's okay.
And so this, we're actually going to move into this right here. So these are titanium implants. And again, nobody's putting pure titanium. It's an alloy, which is a mixture of various materials. And in this particular patient, I talked about earlier, the material interaction with antipsychosis medication, the triple fluorine, and the allograft material, which is synthetic grafting, that you'll see a radical and degradation of bone in a very short amount of time, within months. And so here we are, compare this implant set nicely in the bone to this a couple months later. And what will happen is a lot of, when you have this is called a failed implant. And so when you have an implant that fails, the doctor has to come along and say, why did it fail? Well, the diagnosis on this is perioimplantitis. And another way of saying the implant failed as a result of the patient not having good oral hygiene. And because of poor oral hygiene, you have a degradation of the bone. And that's not what's happening, because they're missing the material aspect of what's going on. The triple fluorine and the antipsychosis medication interacting with the allograft material and the alloy with this titanium implant. And you have and so what happens is they'll remove these implants. They'll then go back and do the same exact thing, putting the allograft material back in, putting another implant in there, and seeing it fail again and not recognizing it's not because of perioimplantitis, it's because of the materials you're using here. And on this side, you also combine your Mercury Amalgam, your gold. So there's a host of dissimilar materials that you're working against. This is not even talking about the systemic aspect that's happening that dentistry is not even paying attention to, because you're focused in on the teeth and not taking into consideration what are the material aspects that's affecting outside of the scope of dentistry.
In this patient in particular, he is a psychiatric patient. He has been taking psychiatric medication for several years, and he decided that he wanted to go have implants done. And when he went to do them, I don't think they offered him anything but titanium. So he went for it. They also didn't offer him anything but allopathic bone, meaning bone that is not your own bone.
Yeah, allography.
And so he went for the whole procedure. And then when he came back to us, his implants went from, okay, they look like they're there with enough gum tissue. But as the months went by, all of the gum and the bone and everything that was around those implants completely receded, and everything had to be removed. Thankfully, he was able to eventually have everything removed, and we made him a partial denture.
Wow.
But he was not. He was one of those people that he was not a candidate for an implant. Maybe even a zirconia implant, and maybe even because of the combination of his heavy duty medication for so many years, and the bone not being healthy at all. So that's one of the things that you had to take into consideration.
Oh, and this right here, I guess I did have this in my talk. I've covered all of this as well. I'm just jumping through real quick to see if there's something that I didn't cover.
And this is a lady that I took this tooth out. It was a root canal treated tooth.
Oh.
And that big thing that you're looking attached to it is the infection that was part of the tooth, completely surrounding the root. And when the root came out, the whole thing came with it. And when you had when you look at a tooth, and if you were to send this tooth to a laboratory to have it tested, you can have an entire list of all the pathogens that are inside the root canal treated tooth.
Just more pictures of it. What was that one?
This is another tooth with a root canal that has a failure. In the panorax, you don't see it very well, but when you go to a smaller picture, you see that the radiopacity right here, all of that dark area, that's an infection. Some of those dark areas are what we see on x-rays, is what it looks like on the actual mouth when we take the tooth out. The picture of the tooth with the rubbery gelatin looking thing attached to it, that's what it can look like on an x-ray.
And so I put this slide in there as a nod to my profession. I used to represent companies designing and building ships. And so in the shipping world, because of the dissimilar materials, you have to strap on a sacrificial anode, a zinc anode, because you want the zinc to be consumed, not the steel or the weld of the vessel. Otherwise it would prematurely fail, and you would lose your ship. So it's interesting to see, and when we're talking with naturopaths, it's interesting that people tend to be severely depleted in minerals such as zinc. And so could it be possible that the materials in your mouth and resulting galvanic currents and electrolysis that consume the zinc? Of course, that's what happens. But these principles aren't taught to a lot of the doctors.
And zinc is essential for our immune system.
Mm-hmm.
Correct.
Yeah, most of us are deficient in it. Mm-hmm.
I covered the high level stacked. I think I actually covered. I apologize, Alex, for jumping around. I got a little excited. Another picture, I'll have Doctor explain that.
This is a picture of a patient that came. He had a root canal on the right-hand side done long time ago. But now he had developed an abscess on the other tooth. And not only did he have an abscess on the other tooth, he had a section of the bone where the missing tooth is that never healed. And that's why it looks so dark all around it. Well, then we took out both of the teeth, the root canal treated tooth, the other tooth, cleaned the bone area where the original tooth was, and used ozone to be able to allow his body to properly heal his bone. He was not interested in implants of any kind, so he opted out for a new bridge that went across the other two sides of the teeth.
And again, here you can see Mercury Amalgam packed down into the canal and capped with a
porcelain fused
to metal. So you've got that battery effect right here.
A porcelain fused to metal is a type of restoration that has metal as the skeleton and the porcelain glued to it or baked onto it. And that was the standard of care for many, many decades until zirconia, ceramic, and many different type of ceramic blocks came available. Some of them are better than others, but at least there is an option now not to have any metal restorations in the mouth.
Mm-hmm.
And this one, you can go and explain this. This is another panoramic.
And if you see on the lower right side, see the area of the tooth with a big dark area? That's an infection, because that area that's dark means that the bone around that root has already been destroyed.
Mm-hmm.
And that's why it becomes dark, because it's all destroyed, it's mushy, gooey. And then this patient has 2 implants.
And you can see the radio opacity of this one, so that it has a higher bit of, it's not pure titanium, it has a higher concentration of the nickel within that. So nickel, you've got the, again, porcelain fused to metal crown, which is palladium, the aluminum, the tin. So you have all of these material, galvanic currents and electrolysis from the dissimilar materials. And the other thing is this topic, there's so many pieces. We're not just talking dentistry. We're talking issues that affect the rest of the body. And again, outside of the scope of dentistry, which is the importance of having the credentials to be able to, like being a doctor naturopath, to be able to at least talk about it. And so it doesn't mean that a dentist is going to necessarily address those other systemic issues. It's being aware of it.
No, that's why it's important to work together with the naturopathic doctor or integrative medicine doctor that the patient is working with, because they'll be able to put together the treatment plan according to what the patient's body ability to detoxify is.
Hmm.
Some people are too sick and you can't do anything.
It's uncanny, say for example, issues, and cancer is one of them. It's uncanny when you're dealing with a patient dealing with breast cancer, where that lump shows up, whether it's the outside of the right breast, inside of the right breast, inside of the left breast, outside of the left breast. It doesn't show up close to the meridian, it shows up on the meridian. And that, like Dr. Thomas Levy's book, Addressing the Tooth, what happens in allopathic medicine is you haven't gone back to address causal contributing issues. So it's very, very important to understand, the issues happening in the mouth as they pertain to the rest of the body, and vice versa. What's happening in implant materials, foot, ankle, knee, as it affects the mouth. So, do you want to start over on the cavitations?
But cavitation is a word that has been used to describe areas of dead bone in the maxilla or in the mandible. And they can be present in areas where a tooth was extracted. One of the most common areas are the wisdom teeth, because the wisdom teeth get extracted. And when the wisdom teeth get extracted, the socket doesn't get cleaned out properly. Every tooth that has to be extracted requires that the socket be cleaned out properly so that the periodontal ligament can be removed. The periodontal ligament is what tells the body, the brain, that the tooth is still present. So if the periodontal ligament doesn't get removed after an extraction, then the brain doesn't know that the tooth has been removed, and that the bone cells need to be told, fill in the hole, make new bone, heal this space that now is here. And so that's the main, those are the main areas where cavitation occur, is the wisdom teeth. Also, any tooth that has a root canal, that has an infection, all of the bone that it has been destroyed by an infection, that's also called a cavitation, because it's an area of dead bone, ischemic bone or dead bone.
And so onto this X-ray here, you go ahead and explain what's happening.
We
here.
want to show you how a CBCT X-ray can give you much more information than a panoramic X-ray. And there's so much more information being provided, you then have to look everywhere, like the sinuses. On the right side is the left side of your screen, but that's the right side of the patient. The patient has a very large amount of his sinuses completely full of mucus or maybe even a cyst. Because when you see it on the other view, you can see that it's a much more rounded shaped type of a mass in there. So then we don't deal with that. We just refer the patient and we explain to the patient, there's something different in one of your sinuses that needs to be addressed by an ear, nose, and throat specialist. And so then it's up to the patient to go and have it looked at. Here in Vancouver, we can refer people to OHSU, the Oregon Health Science University. But other oral surgeons might be able to help with that too.
So then I put these images on here because this was fascinating. So mercury, we've been talking a lot about mercury amalgam. Now mercury is refined from a mineral called cinnabar. So cinnabar actually is mined out here in the Washington, Oregon area. And in fact, people have to be very careful. When you go out and go camping, you'll put a little campfire out there and there'll be cinnabar, loose cinnabar on the ground. Mercury is released with heat. And so you get poisoned from having a campfire. Well, they to use cinnabar in dentistry. And so look, and you could see a dissimilar material for that. When you go and cut this crown, see this, but this is what a lot of the old time dentists used to put in there. Instead of the mercury amalgam, they'd use cinnabar, which is again mercury. Here's another picture, part of a mercury removal procedure. The one thing with mercury amalgam, it does not bond to a tooth. And so the whole adage, drill and fill, they drill it out and pack in the mercury amalgam. Because it doesn't bond to the tooth, you have a micro opening. And that's where the bacteria gets down between the mercury amalgam and the tooth and begins decaying from underneath. So we take these pictures to show areas of decay in case an insurance company wants to know, why did you remove what looks like a perfectly good crown? Yeah. So here's why, the decay that's underneath it. Here's another image showing both the cinnabar and the mercury amalgam. You go ahead and
this one here. Yeah,
mercury, sorry about
that. No, this is mercury too, but this is mercury too. Pretty much the entire tooth had a section of mercury all around it. That's another tooth. You want to go to the next one? All of this was found in the same patient. And she had been seeing a naturopathic doctor for a long time, and she will get better. And then she will get back to sick, and her white blood counts would always get higher. And she kept having to go back and do all these things. Finally, he said, you have got to get all these metal crowns out of your mouth. So when she came and we took them off, that's when we found out that she had a lot.
And a lot of what will happen is when you chelate, you're trying to pull the bound up mercury in the fatty tissues of the brain and the liver and excrete it. When I say excrete it, you're pooping it out, peeing it out, or sweating it out. If your body isn't capable of excreting, meaning you're not healthy enough to be able to excrete that, it gets recirculated and rebound back up. Now, the problem with this is if you begin chelating, I'm going to go back to the x-ray. If you begin chelating, not knowing you have mercury underneath your crown, what it's doing is it's going to pull from the easiest source, the bucket of mercury in your mouth. Mm-hmm. And instead of pulling it from where you're trying to pull it, you're pulling it from your mouth and adding to what you have and making your condition worse. So you have to be very regulating and what sorts of in a person's mouth, because this is going to pull from there, could kill a person. And I say that firsthand because my wife, when she went through chelation, not recognizing all of this, the integrated medical doctor we were working with began aggressively chelating, and that almost killed her.
Wow.
I think that's it. That was the last. Did you, we covered a lot of ground, Alex, and I apologize for jumping all over. This topic is huge. There are so many different directions you could go with it, and each direction could be its own isolated discussion. You had a couple questions that you wanted to raise, though.
Yeah, I just am wondering what you both predict. Like, when will this be common knowledge? When will this be the standard of dentistry?
Well, the likes of what the National Health Federation is doing, being able to go out, sit on and speak at Codex Alimentarius, share this information, disseminate the truth. The other providers that are far ahead of us, like Dr. Thomas Levy, Dr. Hal Huggins, who passed away about a year and a half ago.
2015.
Wow, several years ago. He was a pioneer, and disseminating this truth, it's like you're swimming against the current, and you have an entire industry that says there's nothing wrong with it. So it's extremely difficult. And then you have a component of industry, the 58% of dentists who call themselves mercury free, who want to then cash in on saying that they can remove your fillings. Well, that's true. Anybody can come. However, you have to take into consideration recognizing the mercury vapor you're exposing yourself to, and we just keep pressing forward, sharing the information, disseminating the truth, and working with organizations like yours to be able to get the attention of the larger.
And the IOMT has gotten a program that allows them to bring dental students that haven't graduated yet, to expose them to, hey, this is how you may consider practicing, so that you don't get poisoned by mercury. And so they have developed a scholarship, and they have the dental students apply.
Back. All right, you've been like in and out for the last 45 seconds or so, but
has been a speaker at the IAOMT, and there's other organizations like the IABDN, International Academy of Biological Dentistry and Medicine, and so there are organizations out there. It's just trying to get dentists to recognize what they've been taught is incorrect.
Well, that reminds me, I think, like, Mónica, you know, I know this might seem like a big responsibility, but like what you've learned, like how you went through the process of like unlearning And then relearning, I mean, that can basically be like a curriculum that I would hope to see be maybe a standard for dental school or something like that.
And I think that's the case with the IAOMT. They're trying to reach out to the dental schools to provide them the information to, hey, we got to have these students learn how to do safe mercury amalgam removal. Safe for them, safe for the patient, safe for every person in that building. Because imagine a dental school clinic with 90 kids in the clinic, all drilling amalgams at the same time.
Yeah, that's what I was trying to say, where like I'm a little interested, like, you know, somebody's monitoring the air quality and like how much mercury's in the air. And then, like you said, I mean, it's zero, but like, and I know it varies each person's immune system and ability to deal with it.
Everybody's different, yeah.
Yeah, so I guess there really isn't like a general rule of thumb, but yeah, I mean, that's pretty scary to think about, like, you know, with what I just heard earlier, just one mercury removal, like the vapor emitted could, you know, get into the air and someone in the waiting room, you know, not to mention like what you're saying, like up to 90 people. Well, any other maybe closing thoughts right now? And I would love to, you know, like I said, the plan is to share this as far and as wide as possible. And possibly down the road, we could maybe go live, like after people have watched this video and like commented on it, or, you know, might be able to compile some questions or do something where we're going to start trying to live stream, you know, some of these interviews eventually. So it's something.
Well, I appreciate, you know, the opportunity to share this with you. And, you know, again, we're out here to disseminate the truth. And if there's more information, there is actually more information to provide. We've covered just a small amount of the topics. So each one you could get into to deeper delve into, but it's a start. And having conversations is the start. If you don't, how do you eat an elephant? You eat it one bite at a time.
Exactly.
So.
Great. All right. Well, I know you both are really busy people, so thank you for your time today. I know on behalf
Thank you very much.
NHF members and supporters and viewers that we really appreciate what you're doing. So thank you very much.
Thank you.
Thank you, Alex.
Really appreciate it.
You take care.
All right. Bye.